everyone. In this video, I'll be talking about medication adherence. Now, moving on to another week of studying, we have finished our 12 weeks plan in the last 3 months. So this is another plan for the next following 3 months. So this is the first topic of the actual plan. And this topic is on medication adherence. So this is the very first topic. Now, what is medication adherence? Well, it's just a fancy word for a simple term, which is following and taking your pills. So it's basically just like that. So for example, you have an ear infection, for example, and the doctor gives you some pills to help to clear up that infection or help you to fight against that infection. Then taking those pills on the right time and the right dose is actually medication adherence. So it's just a very complex term for a very simple thing. Now, what I'm actually going to talk about in this video is on the strategies to adhere to our medications and also the barriers, some barriers, common barriers and solutions to medication adherence, and also I'll be talking about using pill organizers and also some pill reminder apps. And finally, to end this video, I will wrap up with a quote and also a fun fact. So, without further ado, let's get started on the first part. So, the first part is actually the strategies to help us to adhere to our medicine. Now, there are several strategies that I've listed here. The first one is tying to our existing habits. So, for example, we have multiple doses and we want to take them but we can't remember. Well, we can tie them to our habits, like brushing our teeth, for example. We can pair them with meals. We can link them to our bedtime. For example, when we're brushing our teeth, we can put them next to the sink or somewhere that is dry, so that when we go into the bathroom to brush our teeth, we will remember to take our pills. Or we can put our pills to a spot where we commonly go to in the house. For example, if we usually go to the kitchen, we can put that in a bowl or a dish, anything that's accessible to the eye. And also, so just pair them with your habits. So anything that you do commonly, just pair your pills with that if you have it. And the next one is plan ahead for travel. So if you're traveling to another location, for example, for your holiday, then you could pack those little pill organizers that have those little weeks. Or if you have more complicated ones, the pill organizers, more complicated, you can put them in time, the amount of time you need to take them. So yeah, that is planning ahead for travel. Also reward your consistency. If you remember to take your pills, you can give yourself a little treat, or make it, or do something that you don't usually do. You can go to an amusement park or do something reward yourself by buying a new book, like that. Rewarding your consistency. There's also several devices that helps you and some technology phone alarms, your pill box, the pill organizers, automated dispensers, and a checklist or a log. I think that the checklist or a log is my personal favorite because I like to check off those checklists and it's very satisfying. So I think that the checklist is one way of doing it as well. And you can also ask someone, for example, if you are in college or if you live with a housemate, then you can ask them, or from some of your family members or your friends, your relatives, to remind you to take your pills every day, because as we get older, our memory gets worse. So that is something very true. And yeah, so those are some of the strategies, some easy strategies to medication adherence. The next part is the barriers and the solutions. So some barriers, again, I've talked about forgetfulness and forgetting as we get older, and these are some of the strategies to help that. But what are some of the other causes, some of the other barriers to medication adherence? Well, there are several actually. The first one is side effects. Now, some people are like very afraid, or they have the fear of like having pain when taking medications, and that can be true because there are some side effects that come with medications, and all medications have side effects. It just depends on whether it is like bad or like lighter than worse or just better. Okay, so the next one is complexity. Like, it's too complex. If you have too many like pills and medications, then it's complex and you can forget all of them. Like, you don't know the order, what to do with that dose, when to take it, or how much will you need to take it every like hour or every day. So another reason is complexity. The fourth reason is the cost. Some medications can be very expensive, and so sometimes we can't afford them. Like, it's not in our budget, so we can't be able to afford that without going out of our budget, and that is another barrier. And finally is doubt. Like, when you take all of those medications and you don't see like any signs of improving, or there's a lack of symptoms, then you might feel doubt that this medication is useless. But no, it is not useless, and I'll talk about the strategies to improve it in the next part. Now, some solutions to these common barriers is firstly forgetting. Forgetting is that common barrier. Some solutions to it is daily reminders. For example, these strategies here that I've listed in the first part. There's also the second one is side effects. So to combat side effects and help you to take your pills, then you can talk to your doctor to adjust the dose to like minimize those side effects. And the third one is complexity. You can link them to routines so that you remember them. I've talked about this as well. And the fourth one is the cost. Well, to like combat the cost or just lower the cost of the medications, you can talk to your healthcare provider to like suggest you some generic substitutes or some discounts, some medication discounts if they have one. And finally is doubt. We can monitor as on our own. We can monitor our progress. For example, like our progress, we can see if it is our health is improving, or we can like talk to our doctor again, and also they will help us to like have some lab test results, or they will help us to educate ourselves on why those pills are doing their job, but they don't show it yet. So it's still working, but it's not visible. So that is some of the barriers and solutions of medication adherence. And finally, using pill reminders and pill organizers and reminder apps. So pill organizers will help us to like prevent misdosing errors, and it's also portable, so you can put them in your purse or your bag or anywhere that you go. And also the dispensers. There's also some like little dispensers that can help you to like have each one each week or even month. So there's this rotating dispenser that you can push them each time of the day, and then it will come out at a specific time. And there's also some reminder apps, like some reminder apps that helps you to log your health, have you to be more consistent, and also tracking our refill, so refilling our doses. And so to end this video, I have a fun fact and a quote, like I said in the beginning. So did you know that good adherence can reduce long-term mortality by risk up to mortality risk by up to 21%. Well, mortality risk is basically your risk of death. So good adherence, good medication adherence, taking your pills can lower your death rate by 21%. I didn't know that until I researched this quote, this fun fact. And to end this video, I have a quote. Drugs don't work in patients who don't take them. Dr. C. Everett Koop. So this is the end of my video. I hope that you have fun learning about some of these things, or if you have any suggestions for improvement, then make sure to leave them in the comments. Thank you again for listening to my video, and I hope to see you soon in the next video. Goodbye!